That actually kind of feels good. In terms of tendonitis, inflammation of the tendons, or tendinosis, for you nerds out there, I've seen people do all sorts of things for self-treatment, things that they saw on the internet. And then unfortunately, some just don't get better. I don't want that for anyone, so let's have a look at what you should pay attention to when you're trying to self-treat any kind of tendon damage. Whether it's your Achilles tendon, your patellar tendon, golfer's elbow, or tennis elbow. And of course, I'm gonna show you what evidence says works best for that kind of injury. Salut, this is Stefan from Safe Motions. There's one thing that I really don't like seeing. Actually, there's quite a ton of things that I don't like seeing, but it's injuries that get worse with self-treatment. It's always worth consulting with a healthcare professional, at least to put you on the right track and make sure you're not going to make any mistakes. But in the meantime, here are a few principles. This is what people usually do to treat their tendonitis. Massaging, massage gunning. I've seen people use hammers, for real. So first off, that pain, that kind of feels good. That's not necessarily good pain because everybody's pain tolerance is different and everybody's feeling is different as well. So in terms of massaging the tendons, you want no pain or very minimal pain. However, it's completely okay to massage the muscle that's attached to the tendon because a tendon is nothing more than a band of tissue that attaches the muscle onto the bone. So if that muscle is always tight and always pulling on the tendon, this is when the tendon might fatigue and get injured. That depends on how you got injured. Something that's often forgotten is around those tendons, those attachments to the bones, there could be nerve bundles. So sometimes you'll be massaging an area and you feel some radiating feeling. So you're massaging, for example, the Achilles tendon and you feel something going down along the foot. It's not necessarily pain, it could be pins and needles, a little bit of numbness. This absolutely does not mean that you're on the right spot and you should massage more. On the contrary, the nerves really don't like to be irritated. So that requires a little bit of research from you on the anatomy of the area where you're injured. Let's take the Achilles tendon. Let me get my friend here. He's got all the tendons. So let's say you want to massage the Achilles tendon. It joins the heel onto the calf muscle and the calf muscle attaches on top of the leg here and there. If you massage this Achilles tendon here, there is a possibility of you hitting the nerve on the side. This might drive a feeling down the foot. It's the same on the inside. In yellow, you can see the nerve. If you massage the ankle, there is a chance of you hitting that nerve. As I said earlier, hitting those nerves, no good. Other things include varicose veins. Don't massage those. Numbness in the area that you're treating, open wounds, swelling. In all the above cases, it's really possible that as you try to massage or use a massage gun or your hammer or whatever you want, you're actually potentially slowing down your recovery or even worse, putting yourself at a risk of another injury because of the self-treatment. Don't get me wrong, I love percussion therapy or massage gunning. You just need to know what you're doing. So how do you make sure that you're not hurting yourself? The first step is to like this video if you're liking it so far. And the second thing is don't massage directly on the tendon. You can massage on the side of it. The vibration should be enough to create some change in the tissues. If you want to massage the calf in all its trigger points, go for it. Same goes for tennis elbow. Again, you can massage the belly of the muscle, but as soon as you get close to the bone, the attachment of the tendons on the bone, then I'd much rather you don't massage directly the tendon, but just go across it. Now, is massage the best treatment for tendonitis? Well, the tendon got injured in the first place because it wasn't strong enough. In most cases. It so happens that tendon tissue respond really well to mechanical stress, when appropriate and timed well. What does it mean? It means that you need to load your tendon or put weight on it, enough that you create change in the tissues, but not enough that you're going to damage it further. That sounds hard. So how can you tell what's enough? Here's the secret. Let the pain guide you.
Pain your guide will be.
If the pain is really high, you're going to start with loading your tendon asymmetrically, which means you're contracting the muscle, but you're not moving. Just like this. For the Achilles tendon or for tennis elbow, if this doesn't create any pain, you can start moving through the whole range of motion. So from the top to the bottom. For runners and Achilles tendons, you need to make sure that you put enough weight over that tendon to have a good response. Your body weight is not going to be enough. So put a backpack on your shoulders, continue heel drops and raises. Once you're able to carry something heavy enough doing your exercises, then you can put the backpack down and you can start doing things that are more specific to running, like hopping, or even start jogging slowly. The next step for tendon rehabilitation is actually full return to sports. For Achilles tendon specifically, go check out this video here. As for when you can safely return to sports, when the video's out, I'll put it up right there. For now, subscribe so that you don't miss on any of those, and I'll see you there. À bientôt!